Jack and I met with Maddie and Olu, as well as with Lori. And in this meeting, this is where Jack was formally advised that the employer had determined that her placement was no longer a fit or suitable. Maddie was good enough to send a follow-up email on the 16th indicating that those in attendance were Jack, Amy, Lori, Olu, and herself. And the meeting was to notify her that her restrictions and medical limitations imposed make this position not compatible with the full scope of job duties required, and therefore the employer needed to clarify their next steps. So that on August 3rd, she had been placed into the permanent position. After 3 months in this role, multiple supportive conversations have taken place between her and her care manager, Olu, where Jack had expressed feelings of being overwhelmed, in which she had provided supportive modifications to the job duties in order to accommodate her restrictions and limitations. I'd like to note here that that is the role of a manager, and that as an accommodation, that's exactly what it is to accommodate her restrictions and limitations. Examples outlining the complexity of the role that cannot be altered, and that based upon her restrictions and limitations do not match this position. They acknowledge that it is through no fault of her own, rather, it is about those restrictions and limitations that deem this position to not be suitable based upon those medical restrictions, or limitations, sorry. So further to this, they indicate that all tasks related to client care, which were triaging phone calls, faxes, essential board and clinic bookings, in-person clients, vendor services, transfers, discharged and deceased clients, and chart management. And under 2, staffing scheduling, flow sheets, maintaining staffing levels, payroll accuracy and time frames. And number 3, troubleshooting and problem solving for clients and staff, orientation for new staff, which is classes and equipment, data collection, room bookings, agendas and meeting supplies, and grand and toy orders and maintaining supplies. So based on Jack's limitations and restrictions, this was the employer's position. Jack required a quiet work environment and less distraction from colleagues, which the employer's position was they could not provide this. An exemption from tasks with low tolerance of errors and tasks that are safety sensitive. A flexibility with deadlines for tasks that require deadlines and time pressures. There's no note as to what the employer's position was as to whether or not they could provide this. A reduced work volume, no comment to that. On September 15th, they indicate they removed the second phone to accommodate you feeling overwhelmed. On September 8th, ESP was removed from her tasks. A weekly conversation regarding counts, so essentially a one-on-one with management. Ongoing issues with accuracy of phone numbers and spelling of patients' names, calendars, and assignments to clinics versus community. There was an ongoing issue with referrals coming in and not managed, triaged in an appropriate turnaround, impacting patient care, specifically palliative, and a request for time to come in early and stay late to complete daily tasks. And then the employer's comments, and sorry, it was Maddie who wrote up the email, essentially just go on to where things are going to move from there. So I know that Jack has the ability to kind of speak to a number of these things, but I also understand that Jack has the ability to speak to a number of these items, which she does later on. So following this, we then met with the receiving area as Jack was being placed back to Rocky View, and had a very thorough conversation with both Hyen Tai and Joanne Becky, who was Jack's prior manager. And there was a follow-up email then sent to Hyen Tai regarding the matter. So the email was sent to Hyen Tai on November 29th at 3:46. and understanding that in all likelihood, nobody here can answer the questions that I then sought clarification from Hyann. But I did say I'm seeking clarification on a few items I recall and understand it was clearly documented in this meeting as well. But I recall from our meeting with Jack and Joanne on November 22nd. Please confirm it was your understanding that Jack's accommodation was successful after she had completed the required 30 days in the position after having spoken with Madison Bigger, HRBP. Did you provide Madison with a confirmation of accommodation form with the understanding this would be completed? As this was a statement that was also made in the meeting that Hyann indicated she had sent the form over to Madison and it was to be completed. At what point during Jack's placement in Strathmore were you contacted to indicate any issues or concerns had been identified? This email has also gone unanswered. So following a number of these meetings, Jack also submitted her MSN, which we'll speak to in the other grievance. But there's a number of indicators in her MSN where Jack indicates concerns about lack of training, different training that she received than others in the department, concerns where she's set up for failure, feeling sabotaged in the area, going to leadership for context on items, to be provided insight into situations, being directed by management to change processes from the old ways of doing things, and then feeling negative feedback when things are being changed, and feeling she's the individual who had to defend herself when things are changed. So based on all of these issues, going into a brand new area that she's been accommodated into, we're not entirely sure how this accommodation process actually fell to her as the individual who actually ended up leaving the area. Jack, do you have some more insight into the situation as a whole?
I could
speak to the training component of it, because I know that it was very much ongoing, and there's no argument there. I know that there was ongoing training that lasted quite a significant amount of time.
Well, initially I reported to the Strathmore office, and that was a short week. It was a long weekend holiday, so we only had 4 days there, and Olu was with me those days. I was provided some typed notes on how to discharge clients, how to start a new, how to triage, that sort of thing. It was a little bit haphazard, referred to it a few times, and then at one point had to kind of rearrange it so that pieces fit together a little better. But in the second week, I was asked to go to Airdrie. Olu was going to be away that week, so there would be no one to actually train me. So I went out to Airdrie, reported there for the week, and I did some chart creation, did some processes in Paris. I still did not have Paris access per se. I had no formal training since years ago, so I had to renew. And I wasn't asked to do it then. It was done quite a few weeks later, and it was done while having to answer phones. So I wasn't given backup to actually do the training. I had to do it while I was answering phones and doing the faxes, et cetera, greeting clients. So in Airdrie, the way that they did things payroll-wise, the way that they handled charts was very different than the way that Strathmore handled things. And that can happen. I completely understand that. It was good to have an idea of how they did things, but it really didn't lend to the training part of what I actually needed to do in Strathmore, especially if I was still trying to have to support Chestermere as well. And so I went through training, I was there with Olu some days. Some days I was by myself trying to work through this typed up information from the previous admin and trying to onboard people without having any instructions on how to onboard. There were absolutely zero notes in that binder about onboarding new staff. We had a couple of physiotherapists and therapy assistants coming on board in those first weeks. And it was later, several weeks later, when Teresa, who was the previous admin, who had been away on her retirement, came in to train for a day. And I can't say that it was a pleasant day. It began with several criticisms right away, and that ties into some of the changes I had been asked to make, but apparently she had not been apprised of them, so she felt that I was just blowing things up. And I've been very specifically requested to reduce the amount of paperwork, change the way the filing was done, create new systems for how that people that were receiving supports and how they were awarded them, how they were being handled was a lot of paperwork involved, separate from their actual file. So I was asked to create some electronic way of handling it, which I was starting to do. And a couple of days, the lady from Airdrie came in, but again, she was just creating some chart shells, if you want to say it. It wasn't an actual chart, it was just a shell. And she did some of the filing, rearranging some of the filing, trying to group it into a more sensible way. That received a lot of flack. The case managers were quite upset that they had not been consulted on these changes. I get that, but I bore the brunt of that, and I did not hear once Olu take any responsibility for having instructed me to do that. Several weeks later, a girl was hired, Laura, to work in the Chestermere office part-time, and Teresa was asked to come into the office around Thanksgiving to give 3 days worth of training to Laura, who is a part-time admin in Chestermere. And I had only had one full day with Teresa in those several weeks, but yet the part-time person was given a different level of training. And during the time that Laura was in the office, there were a lot of inappropriate comments by Teresa about the way I was handling things, about the way that Airdrie was handling things, and that I wasn't doing them right, that should have been this way, and it just was not, again, a very pleasant experience. It wasn't a learning experience at all. And when it came to adding clients to the whiteboard as a new client or a recurring client, I got bits and pieces from different people over several weeks. So first it was Olu instructing me when a new consult comes in and it says 7 to 10 days, you put it on the calendar in 7 to 10 days from the date of receipt. Well, the case managers got quite upset about that. Looked like it was my error, but it was the way that Olu had instructed me to put them on there. That was then revised that I should put it on the calendar the very next day, but then very specifically say it was to be seen in 7 to 10 days. The case managers would discuss that in morning report. Whoever it was assigned to would then follow up in 7 to 10 days. And the same thing happened with doing payroll. It was Teresa wanted it done one way. When I was in Airdrie with the admin there, her practice mirrored how I had been doing it in my previous positions, so I adopted that. And then when Laura came in, she wanted to do it in a different way. Part of it was saving all of the changes, requests for time off, etc., on the drive, and then several days of the week I would check it, and then several days she would check it. But she later reported to Olu that I wasn't checking things. I'm like, well, how do you know I'm not checking it? Well, she neglected to say that when I check the information on the drive, I should write at the end of it, checked. Whereas I had just been going in and saying, yes, I see that in ESP, and then go to the next one. Yes, I see that in ESP. I don't see that. I'm going to have to follow up on that one. But I did my follow-up. I did my checking as a timekeeper, but no one had told me the tidbit of saying you need to change the name of that file to checked. Simple as that. But it was like, how many changes just to doing payroll in less than 12 weeks?
Thank you, Jack. These are just a few of the examples, Jennifer. And I think for Jack, a number of things that she brought back to me were really simple day-to-day scenarios, or at least things that I hear back from many other members, in that when you're starting in a new role, even if it's been a few months, when you have questions, new management or your management or supervisors often will say to you, if you have a question, come talk to me. If you have a concern, come and talk to me. And in what she has advised she experienced, where she would do that, and as time went on, she felt as though she was experiencing sort of some frustration, in that, you know, Olu absolutely was trying to help and was very good about it. You and Olu got along famously, Jack, is what you had indicated.
Mm-hmm.
But that I think Olu was growing tired, I think, because things weren't getting better, and you were expressing that same frustration. And so we don't know, because Olu's not here to answer to it, what she likely may have been experiencing on the other side. And what you thought was simply you were asking for advice and seeking advice on how to deal with what you expressed to me was sort of those interpersonal conflicts more than training conflicts. Olu, we now find, feels most of it was training issues or issues with the position. Is that sort of fair to say? Jack, if I can just ask, because it was something you said, or I guess this question is probably better answered by Lori. If Lori could answer it. Lori? Sorry, you're on mute, Lori.
Yeah, I'm sorry, what's the question?
Sorry, who would be responsible for advising staff, so in this case, probably the case managers, when changes would have been made that Jack had been told to implement? So like, how is something like that done?
All the changes are discussed usually from the care manager to the staff at various, either in staff meetings or in morning meetings or, in emails.
Okay, so I know that part of the conversations that we've had, morning meetings often presented with conflict as well. And maybe that's better for the other hearing and things, but Jack had been advised at one point in time that she would be provided with time to communicate with staff of potentially needs or things, and that wasn't often occurring. So without getting into any more of the logistics, it is our position that Jack had fulfilled the amount of time required for this to be her permanent placement. Whether the form was filled out or not, it should have been after the 30 days. If the employer had performance concerns, they actually should have brought those forward and dealt with them appropriately. But this position did become a permanent placement after those 30 days were successfully completed. To indicate after essentially 90 days, so 3 months time, that this is no longer an appropriate placement, goes against the employer's own workplace accommodation process guide. It actually doesn't meet the threshold. And so, you know, we're here to kind of try to talk about this. We're here to try to figure out a better way for this to be resolved.
I just need some clarification on some dates. And then, let me just check here. I got a little bit lost, and it was just because I didn't type fast enough. I believe you had made a list, Amy, on, you provided all the examples, the list of examples of what accommodations were required, like a quiet area exemption of tasks. And so I got to there, and then you said, I think you said September 8th, ESP was removed. I'm pretty sure you said there was there was something else right before that.
Yeah, so this is an example from the employer's perspective.
Yeah.
So let me just find it for you here.
And I'm going to just interject here, if you don't mind.
Yeah.
I don't even know what that statement means. At no time was I told not to do timekeeping or not to look at requests for time off. I was doing both up until the day I was.
So this is the employer's perspective, and that's why I presented it, Jack. Yeah. So this is an email, like I said, Jen, that was sent by the employer in follow-up to our meeting that had taken place on the 15th. And so we had our meeting on Monday, November 15th. And I actually, if everybody on here is comfortable with me forwarding it to Jen, I'm happy to do that. And I'm happy to CC you in on it, Jack, as well, so that you see what's being sent. Mm-hmm. But essentially what it says is, you know, there was the September 15th date, which references removed the second phone to accommodate you feeling unwell, which, you know, there's a little more to that situation, Jack, and you'll speak to it later. And then it says September 8th, ESP was removed from your tasks. After that, it says weekly conversation regarding counts.
Yeah, that would have been how to determine if we had met our threshold for minimum staffing. And if we had not, then the need was to put in a request to our ESP scheduler to put out a call for somebody to cover. And it would also lend to people asking for time off. If I were to go in and see that on a specific day we were short and someone was asking for additional time off, that there should have been something mentioned to OLU and then whether they could have the time off or not. And it was a significant different procedure than how I had ever handled time off requests before. First, doing the count, but then secondly, being the person to say yes or no. Usually that would have been done by my executive director. So I don't know if it was a difference in professions or what, but it was a significant departure in how I would have approved time off in
So
ESP.
may I ask a question then, Jack? So if you had had ESP removed from you September 8th, based on this email, in theory then, would you have continued doing weekly counts? Because don't those two duties remain together?
Yeah.
So it's a bit contradictory then, those
Yeah.
two statements.
And I'll also add that I had requested, the employer says I had requested to come in earlier and to stay late to complete work. I don't recall a time where I would have asked to come in earlier, but because I was commuting back to Calgary, tongue in cheek, everybody and their dog knew I stayed until after 5 o'clock just to avoid traffic on my commute back to Calgary. I didn't do work. I actually had a yoga mat and I would stretch in the file room, learning min and max on occasion when the phones weren't ringing. I might look at that, but it was not a specific request in order to get work done.
That's good to know. I don't think I knew that either.
I did stay late once on my own accord to look for missing paperwork. And I did that completely on my own. And it was because I knew there was something wrong with this missing paperwork.
Yeah. You mentioned you were traveling back to Calgary. Now I also understand, and I know most of us here do, but I am going to ask you to speak to the fact that you did stop having to go back to Calgary. Can you give us a little bit of information about your move out to Strathmore for this permanent position, please?
Yeah, given that the significant history with Alberta Health Services, my work history, I did believe that getting into the 88th and 89th day of my new position without hearing anything that was anything indicating that this was not going to be successful, I committed to the position and moved out to Strathmore. I was very concerned that over the winter, if there was a storm and I was still living in Calgary, the commute could be a problem. And I actually asked, what do we do in those situations? I asked Olu that. How do we make sure that there's coverage? And there was mention, well, there's Teresa and there's Laura. And so there was sort of a quasi plan if I were not to be able to make it. But given that it was a 2-hour commute at that point each day to go from Calgary to Strathmore and Strathmore to home, I made the commitment and signed a 1-year lease on like October 29, moved out, and I'm still living in Strathmore, but now I'm commuting to Calgary 2 hours a day to do a screening job at Rocky View because this accommodation failed.
In the employer's eyes.
In the employer's eyes.
So did somebody out in Strathmore mention, and I shouldn't say Strathmore, sorry, I apologize. Where did this idea of 90 days come from with anybody? I'm curious about that, and it may not be a question even directed at you, but I'm not understanding the 90-day time.
So I wonder if we should just pause that and then maybe let Lori and Madison respond, if that's okay, given the time. Thanks.
You bet.
Madison and Lori, I'll turn it over to you.
And I will go on mute.
Okay, so thank you very much. So on August the 3rd of 2021, Jacqueline was accommodated from a full-time admin 5 position into a permanent full-time 4 position with integrated home care at Strathmore with the following restrictions: a reduced work volume, which included regular and prolonged cross coverage of others, requiring more time and less volume in her duties, less demanding tasks, which were really based on physical tasks, flexibility with deadlines for tasks that required deadlines and time pressure, needed to have additional time if the task was complex or required any type of analysis, to be given ample time to complete those required tasks, to be allowed to ask clarifying questions, to have go-to resources available while learning new tasks or learning complex tasks that required analysis, exemptions from tasks that required a low tolerance of errors or that were safety safety and time sensitive, complex tasks that required precise, detailed, accurate work that may propose a safety risk. An example of that was working in pharmacy. Comfortable with repetitive, straightforward, non-complex, non-analytical tasks and required a quiet environment with distraction from colleagues to complete any kind of complex or tasks that required ongoing analysis. So the Admin 4 position in Strathmore supports both the Strathmore and the Chestermere Home Care Office, as well as both the care manager and, on occasion, the area manager. This is a public-facing position that interacts daily with the clients, the families, other departments, both within home care, acute care, emerge, the lab, physicians' offices, vendored services. The team is comprised of RNs, LPNs, staff that work in our ADP, so our recreation staff, some OT, physio, and social workers. The main duties of the role are such, but not limited to, managing the phone, the faxes, and problem-solving multiple client issues in a timely manner, greeting and directing clients coming to our clinic, managing the clinic schedule and booking appointments, admissions, discharge, and chart management, staffing, scheduling, payroll, and the daily flow sheets for the rural team and the rural Northeast management team, assisting staff and clients with related issues, ordering IT equipment and managing equipment issues, maintaining the client boards and the calendars, data collection, maintaining the phone list, maintaining the emergency contact list, supplies and equipment, organizing the orientation of new staff and education for employees, booking meetings, rooms, doing the agenda, minutes, and project work as required. As I said, liaisoning with other departments. This position is a representative on the Joint Workplace Health and Safety Committee and must be able to deal with multiple competing priorities and constant interruptions. Due to the nature of the position, the Admin 4 must be able to demonstrate flexibility when dealing with changes and demands in priority. Must be attentive to detail and have strong organization skills, as well as an ability to interact effectively and positively with a diverse group of people and work as a team member. The position also requires the ability to exercise sound judgment, professionalism, diplomacy, and discretion at all times. Other responsibilities include completing the staffing and scheduling, timekeeping duties, and as I said, booking rooms and meeting the needs of the team. Jacqueline's Admin 5 experience outlined in her resume that and also it was determined during the meet and greet that it was appropriate for this accommodation process. During the meet and greet, myself, the care manager, Olu, and Madison were present. In this discussion, A significant amount of time in the meet and greet was spent on discussing the role requirements and the expectations of this position. We did, in fact, were quite transparent about the fact that a quiet work environment was not available in this position, as the admin force sits in the middle of the office, the home care office, and there are many distractions happening around this position at all times. At this time, during the meet and greet, Jacqueline demonstrated a high level of confidence for being able to address these roles and responsibilities. Also, in that meet and greet, we asked Jacqueline about the issue around commuting. Was she going to be able to meet the requirements of being able to commute from Calgary to Strathmore on a daily basis? And we were assured that that was in fact not an issue, as Jacqueline herself indicated that she liked to drive. So orientation began with the following schedule. On August 3rd to the 6th, there was training in Strathmore. On August 10th to the 13th, there was training in Airdrie, working in the front, answering the phones, working with Paris, dealing with fax, and dealing with the public. Orientation continued in Strathmore from August 16th to the 19th with arm's length supervision from the care manager, and on August 25th and 26th had direct supervision from a casual admin working in Strathmore, and on August 31st received orientation from Teresa specifically on ESP. After 4 weeks of general orientation, meaning that that would be the same amount of orientation provided to any admin for working within rural North and East home care teams, concerns with managing the workload within her medical restrictions and her limitations were identified as follows. Reduce work volume. So the concern there was about asking to have one phone as opposed to 2 phones ringing at the same time, as she was reporting that the workload was overwhelming. On numerous occasions, she was unable to transfer the phone call and disconnected the caller with no attempt to get the caller back online. So didn't get the information from the caller in case the call was dropped. She was only able to manage part of the role, staffing and scheduling, and not able to manage the time off requests. Flexibility with deadlines for tasks that require a deadline and that are time sensitive or are under time pressure. These tasks are not complex to the department, but they were complex to Jacqueline. She was noted that she was sitting at the computer, the phone was ringing, but she was not able to answer it. When she was informed that the phone was ringing, her response was, "I know, but I need to get this branded toy order in." As an admin 5 with her years of experience, not being able to prioritize tasks was a concern. She requested additional time in the morning to get settled in as she was feeling overwhelmed. She was staying late to complete typical tasks that could have been completed during the day, printing off weeks of time cards, and then needed to be informed that ESP guidelines did not allow this, even though she had received the training in ESP previous to coming to this position, and also received ESP training from the previous admin. There was no reconciliation several times of the time cards on the following Monday, as she said she didn't have time. So with tasks with a low tolerance of error or that are safety sensitive, we received a number of client complaints stating that their experience with our receptionist was rude, was condescending, and resulted in them walking out of our office extremely upset, or that were rude, condescending, and resulting in clients being upset on the phone. Faxes were not managed in accordance with the role and expectations. There were multiple errors of spelling errors of clients' names and bookings, resulting in delays of care, specifically around our palliative and end-of-life clients. At this time, ongoing coaching conversations have been taking place between Jacqueline and Olu, as well as additional orientation had been put in place for 4 days with Olu in Strathmore, 4 days with training in the Airdrie Clinic, and 2 days of admin support with our admin here in Airdrie. And then I think that's you, Madison.
Thank you there, Lori. So further to that, and as Amy had outlined, on November 15th, 2021, management met with Jack Tobin and her AUPE representative, Amy Present, where it was communicated. After 3 months in the role and multiple supportive conversations between Ms. Tobin and her care manager, Olu, where Ms. Tobin expressed feeling overwhelmed, in which she was provided supportive modifications to the job duties in order to accommodate her restrictions and limitations. With this, it was shared the examples outlining the complexity of the role that could not be altered any further based on the restrictions and limitations. So in that, we also acknowledge that it was at no fault through Jack. Rather, it is about the medical restrictions and limitations that deem the position to not be a suitable placement. So all those tasks outlined as it relates to client care were triaging phone calls, faxes, essential board and clinic bookings, addressing in-person clients, vendor services, transfers, discharging deceased clients, chart management, staffing, scheduling flow sheets, maintaining staffing levels, payroll and accuracy timeframes, troubleshooting and problem solving for the clients and staff, and orientation for new classes such as classes and equipment. Further data collection, meaning phone lists, safety aware, emergency contact lists, room bookings, agendas, meeting minutes, and last but not least, granted toy orders to maintain supplies. So in that form of tasks, we took those and starting from 1 down to 7, determined what are the most time sensitive and important tasks to complete. So I want to note that triaging those phone calls was noted as one of the more high priority tasks, and with grand and toy orders being less low priority, and the expectation to get those done in the timely manner. So further outlining exactly where Amy had as well when it comes to a quiet work environment with less distractions from colleagues. As much as Olu and the team tried to maintain that less distraction, it was very difficult, and as noted in the initial meet and greet, given the placement of the desk for that role is in the middle of that home care office. Further, September 15th, it was determined to remove the second phone after hearing from Jack that she felt overwhelmed with 2 phones. And then September 8th, the ESP portion was removed from Jack's duties. And I just do want to clarify, when it comes to ESP and counts, Olu tried to manage the ESP while working on the training around counts. So further to that, with the weekly conversations happening regarding counts, that was Olu's attempt to coach and train on those counts, so that with the further intent that ESP could then get re-added to the job duties. So with the ongoing issues of accuracy, phone numbers, spelling of patients' names, calendars and assignments with Clinic First Community, and ongoing issues with referrals coming in, not being managed and triaged in an appropriate turnaround time, impacted patient care, and as Lori noted, specifically palliative clients. So again, going into the further steps, those were provided in email after our meeting on the 15th. and I'm going to just speak to the articles being grieved, so Article 4, 6, and 9. Starting with Article 4, the employer believes they did not violate Article 4 as we exercise its rights in a manner of professionalism, fair and reasonable in the challenging circumstances of providing safe work for Ms. Tobin, and being able to successfully manage within the medical restrictions and limitations. Article 6, the employer believes in no way acted in any discriminatory manner, as the employer had every intent to modify and support Ms. Tobin in the Admin 4 role, based on Ms. Tobin's extensive Admin 5 experience. However, after extensive additional training put in place, modifications to the job over 3 months, it was determined by the employer that the medical restrictions and limitations deemed this Admin 4 position to not be suitable or safe for Ms. Tobin to continue performing. As it relates to Article 9, the employer believed that Ms. Tobin's performance was not deemed to be disciplinary action through multiple coaching conversations, which it is our intent, and we do our best to utilize that coaching and supportive measures before going into disciplinary action. And given the transparency from Ms. Tobin and many of those conversations between her and Olu, feeling overwhelmed with heavy workload and expectations was most certainly not, performance that Olu felt deemed any disciplinary action. So with that, the employer's position is that Article 9 did not apply in this situation. He did not feel it would be appropriate to enact any disciplinary measures for an individual attempting to manage extensive medical restrictions and limitations. So I want to speak to that workplace accommodation aspect. So focusing on that process guide, 4.3, undue hardship, is declared when the alterations to the environment are such that these would prevent the employer from carrying out the essential business. As Lori previously detailed, after 3 months of modification to the role, bundling duties, additional training and coaching in the role itself, ongoing concerns presented a risk to patient care and the employer's ability to accommodate Ms. Tobin. When it does come to that process, I'm just going to share my screen here, referring to that general flow chart. This discussion did come up multiple times on our end when it comes to understanding this flow chart. So as Amy had mentioned, that successful accommodation form and signing that off after 30 days, it was determined when it comes to...
Sorry, Madison, are you sharing your screen?
Oh, trying to.
It's still not showing.
There we go. How's that?
Yep, it is. Yep, there it is. Thanks.
So when we look at this and leading into the channels of yes or no, we have, is the employee able to return to their position with home unit with appropriate modifications? So in this situation, with Jack being primary to Rocky View, this would actually lead us down the path of no rather than yes. So further to that, as we go down these channels, and this is where we ended up with unable to accommodate within the Rocky View site. And so with that, this process map does not speak to the time frame when the accommodation takes place outside of the home unit, rather when the answer to accommodating within the home unit with appropriate modifications would lead us down to speak to that after 30 days of full duties. So I did just want to clarify that when it comes to this lovely process guide. I know it's easy to look at it and when you're applying this situation specifically, we would move down this orange channel of unable to accommodate. And so with that, I want to speak to that 90-day aspect as well when it came to the significance of the the restrictions and limitations and being unsure, how they would apply and be maintained within this current area. The employer was very hopeful with more training, more coaching, and more supports provided during the 3-month period that Jack would eventually become successful, and it was not based on solely the restrictions and limitations and seeing it as performance. So with that, after the 90 days, it was determined that the restrictions and limitations, and as outlined, not at any fault of Jack's, which is why we didn't enact any disciplinary action, that it was rather unsafe for not only Jack, but as well for the client care. And so in determining that in that time frame of 90 days, the employer felt that that was an extensive amount of time to decipher if it was performance and if it was restrictions and medical limitations. And that's why we deemed that to be a failed accommodation rather than go down the performance management route. So share, and so with that, in conclusion, the employer believes they made good faith efforts in providing Ms. Tobin with a suitable placement. As a previous Admin 5, the employer was confident that Ms. Tobin would be able to be successful in the role. However, at no fault of her own, it was identified that the medical restrictions and limitations deemed the position to not be suitable nor safe for Ms. Tobin to continue. And with that, the employer recommends this grievance be denied as there was no violation of the collective agreement. And that's all.
Okay. Thanks, Madison and Lori. Amy, any questions or anything to follow up on that?
No, obviously we don't take the same position on the charting. Sorry, I've got to find mine again. Sorry, there it is. Where you go down your side, and I agree that it's not, sorry, I can't share mine because I don't have mine on the computer. But it's the middle one there. Is the employee able to be placed in a reasonable accommodation with a larger department program portfolio within the next level of leadership area of authority with appropriate modifications? That's where we slipped over to the alternate position identifiable. I get that it's not the exact same slide over, but being that AHS is one employer, that's where we would take the position. And again, I would love to know where the 90-day piece comes from within AHS. The whole, where did the employer come up with, Madison, that 90 days was the threshold? And in part of this conversation, where is it that in Jack's case, she wasn't already placed permanently and the accommodation then would almost start based on her medical, that we would be accommodating her from her admin 4 role through you guys? How is it that we're now starting again? And again, these are just questions and having the conversation in her position in Strathmore.
Yeah, you bet. And it is the 90 days that did come from the advisor working with placing Jack into Strathmore. And so that is what made us take a further look at our own accommodation process to determine that, you're right, Amy, 90 days is not mentioned in here. However, that was communicated in the initial placement as an opportunity to determine whether or not this would be a suitable placement based on the restrictions and limitations being fairly difficult to take and read and not have much of a opportunity to demonstrate whether or not it was appropriate.
Yeah, and like I said, that's a huge concern. I for Jack and for me, because we worked through this, it really felt, and Jackie, you've got to be able to speak to this, and we'll speak to it a little bit more later, as though she'd made these plans and had made it known to her leadership that, hey, I've made the move now, I'm here, I've arrived. It was well known in that office that she was now coming out to Strathmore because this was now her home and she was going to be living there. And then she immediately got this news. It was almost as though her leadership panicked because she was now going to be out there and they had to make a decision really quick, but she'd already signed her lease.
And I understand why, how that may look. Amy, as you know, there's multiple conversations that are had on our end for the, abilities, legal, labor relations, as you and I spoke in the early phases of this, and those conversations take time. There was a lot of detail.
Yeah.
I think you've frozen.
Yeah, Maddie froze.
Yes, she did. Yep. Okay.
At least not in an awkward spot.
Yeah, right, with your mouth open. Okay. With that said, I wonder, do we pause it here and wait till she can come back and then start the second portion?
Maybe we do, because there is some more details. And like I said earlier, I think there is a lot of, I think the second one's going to be quite a bit shorter. Jack's going to be able to do a lot more of the speaking on right, Jack, and maybe you want to wait. She disconnected, so now's a good time, I think.
Okay.
I'm going to disconnect you because I haven't been able to mute. I've got something running on my reason, so I'm going to reconnect. How long do we think? 10 minutes or so?
I was wondering about maybe 10-15. Would that be okay?
Absolutely.
Okay. All right. That's perfect. We'll regroup in 10-15.
Okay.
Thanks, everyone.